RVd has been established as a standard of care induction regimen for newly diagnosed myeloma patients. And we previously published 1,000 consecutive patients treated with RVd at our institution. And we showed really impressive both depth of response and long-term survival benefit in a real-world population. And since that time, randomized data has shown that the addition of a drug called Daratumumab to the RVd backbone has really deepened responses in newly diagnosed myeloma patients and led to a survival benefit. And so we began using D-RVd in our clinic 5 years ago. And so since that time, we've accumulated about 320 patients who've been treated with D-RVd at our institution. And we chose to do a comparative analysis with these patients compared to our historical RVd cohort. So really looking in a real-world setting, is the addition of this drug really translating to the real-world setting, what we're seeing in clinical trials. And so what we saw is just that. We're seeing a deepening of responses in patients by adding Dara to upfront RVd prior to transplant. And we're seeing this across notable subgroups. And even though the follow-up is early, we're seeing that depth of response translate to survival benefit. And I think really interestingly, what we're seeing in our population is very similar to what the randomized clinical trials are showing. So really kind of validating or confirming the validity of our data, that we have confidence in our data. And I think there's also benefit in a real-world data set in shedding light on certain subgroups that are often underrepresented in clinical trials.